today's video is the first part of my summary lecture series, and to my students I will be discussing the development of economic field of study from a very simpler version to a more complex welfare-based field of study of economics. Now, initially it was thought that economics is simply management of household. Like, this household doesn't mean only a household, but it can also be thought as a firm, industry, or a country. So it's management. Simply management of, like Adam Smith later defined economics, is that it's a statesman or a legislator who manages twofold objectives of a country or a household, is that to collect revenues and use these revenues on public services, right? For example, in the household, the earning person earn income and then use that income on their household services, right? But after that, Marshall went a little further, and he thought that economics is actually study of a man in the ordinary business of life. It's very self-explanatory, means to understand the human behavior in the ordinary business of life, like how he or she gets his income and how he or she uses it, right? And then Robbins actually elaborated the Marshall definition into a more detailed version, like economics is the science which studies human behavior. So these two are related, and these two are related. So in the 20th century, Robbins said that economics field of study is actually studying the human behavior in relationship to what? In relationship to ends like demand and resources scarcity. Scarce means which have alternative uses, like human behavior or human decision making about their what they should demand within their abilities like income, and because the resources like their income is limited, so there is a scarcity. So here we can understand that economics is not a very simple subject, but it's more a complex theoretical and analytical field of study. So after understanding all these development in the field of economics, I have come up with my own version of economics. And what I think is that economics is the mental, because resources are limited, there is scarcity of resources, right? So because of scarcity, human actually practice like mental, physical, and financial striving means struggle here, of individuals, firms, and countries to achieve socio-economic welfare or simply development. Now here we come that mental striving. What is mental striving? Is that like think tank of a country or a firm, right? Or of a household, like planning, right? It's a mental struggle, time management, etc., etc. And physical striving, very self-explanatory, is that using your physical abilities or physical resources such as healthy human, your land, equipment, capital, etc. And financial striving means financial resources like money, income, revenues, profits, costs, savings, means how much to consume and how much to save and how much to invest, in what we should invest, etc., etc. So now that we know economics' main objective has been developed from simply management of a household or a country or a firm to a more socio-economic welfare-based field of study. Now welfare. Now after understanding this, what is welfare? So welfare has a number of concept or construct. So after studying this, you will understand that why economics is a more complex field of study and why economics has been integrated and applied in a number of field of studies, right? So welfare. So here I have prepared a table, a summary kind of table, with a means what are concept or constructs of a welfare, what can be a variables of a welfare, and main objective, right? So first, very basic, is happiness, means happiness of people. So here in economics, mostly microeconomics, the variable is utility. It's a measure of people's or individuals' happiness or satisfaction. So what is its main objective? Is to maximize our utility, means to maximize our happiness or satisfaction, improve happiness level of the people. So through utility we measure this. So if the utility is increasing, so what our objective is to maximize our utility within our budget constraint, within our income level. So first is this. Now second and third and fourth, it's actually mostly related to firms or industries, right? So here comes the management, like for efficiency. Efficiency variables are revenues. If there are if a firm is producing higher revenues or profits, earnings, so mean the firm is efficient in its output or production, and minimization of cost. So in the concept of efficiency studies, main objectives like firms or industries tries to acquire efficient production processes for higher revenues and decreasing cost. Means if a firm produced higher level of production with a minimum cost, means the firm is efficient. Right now, there is a more little bit of related but more developed version of efficiency is Pareto efficiency. So what Pareto efficiency, what are the variables, is that distribution or efficient allocation of in-hand resources, the firm which have resources. So in a Pareto efficiency, what is the main objective? So the main objective is distribution of your in-hand resources in such a way to get best possible level of output. That's why the Pareto efficiency concept has been depicted through production possibility curve. So here I have highlighted the two related words. So in Pareto efficiency, we allocate our like human resources, like our labor or workers, doctors, nurses, right? In such a way to get best possible level of output or outcome or best outcome. So the best outcome means there is a welfare, right? And optimization is actually related to mathematics, which has been mostly studied in mathematical economics, which is a subject or branch of economics. So optimization, the variables are actually maxima and minima. It's a mathematical approach to estimate or calculate maximum value of output or minimum value for the cost. So these five are kind of four concepts are kind of related. In happiness, utility maximization. Efficiency means firm is efficient. Pareto, if a firm is Pareto efficient, it means that firm is efficiently allocating its resources to get best possible level of output. And mathematician actually calculate on the basis of their inputs, like what they have in their hand, like resources, physical resources, human resources, financial resources, and then do calculation to actually calculate a value, maximum value, that with in-hand resources we can actually produce this level of output, and that output will be efficient, means best output, or minimum at minimum cost, right? Now these are a kind of very basic pure economics concepts. Now suppose here if someone asks you that what is the main core objective of an economist or an individual or a manager of a firm or a statesman of a country, so in welfare we actually, our main objective is to maximize our utility by utilizing our resources efficiently, right? Now these are basic economic concepts and their objectives and variables. Now economics, as we say, that it has been nowadays integrated into a number of field of studies like health, right? Because if there is welfare, health should be there, right? Welfare means happiness, right? Here which we mentioned. So if you are healthy, or if your population is healthy, so that country or that household welfare will be higher. So that's why economics has been applied in health, which comes as a subject of health economics. So what are the variables? Like better health outcome, higher value of life expectancy, Delhi's health expenditure. These are some of variable, and there can be more. And main objective is health quality, to improve health quality. So if the health quality is improved, so there is improved welfare, disease control, fewer cases of illness. So this is the main objective of health. So means, suppose if our hospitals or health sector is working efficiently and utilizing or allocating our in-hand resources efficiently, like doctors, nurses, our pharmaceutical resources, then our population will be healthy and we will achieve welfare. And as I mentioned in my definition, is that to achieve socio-economic welfare. Now these like health, income, education, social security, our living environment, infrastructure, family size, etc., these are the indicators of socio-economics. So income level, like variables are income level. If income level are higher of a country or a household, so our welfare or happiness level will be higher. And per capita income, and our main objective, the main objective of economics is to practice mental, physical and financial striving to get higher income, controlling the poverty level, right? And another socio-economic indicator or dimension or construct is education level. So variables can be education level and educational quality, means better schools, higher enrollment values. In social security, like law and order, peaceful living environment, etc. And then comes the environment, like pollution levels can be our variables, and pollution control, and infrastructure, communication like roads, water supply, electricity. So these all are related to human or socio-economic welfare. So like if a country have better infrastructure, better communication services, water supply and sanitation. I hope you are with me and you are getting the point that what is the subject matter of economics. So till this we have come that from economics it's not simply a management of household, a firm or a country, but it is a more of a studies of human behavior in terms of their mental abilities, physical abilities or resources and financial resources, and to manage these and think about how we should use our resources efficiently and financial resources efficiently to achieve socio-economic welfare or to improve the quality of life, right? So now, as you understand the subject matter of economics and its application and integration, so in this series I will be more focusing on the integration or application of economics in the field of study for my health economics students. So now, economics and health. So we can say that in health economics we actually apply economic theories, economic concepts, their models and empirical or analytical techniques to the analysis or evaluation of the decision making by individuals like health policy makers, patients, doctors, nurses, healthcare providers, and governments with respect to health and healthcare, right? Means application of economic techniques in the analysis of health sector to improve our health sector. Or we can say that health economics is a branch of economics concerned with issues related to efficiency, effectiveness of health intervention, and value and behavior in the production and consumption of health and healthcare services. Means to produce healthcare services, production of healthcare services, we can say that producing doctors, constructing hospitals and basic health units, etc. And then consumption, and who consume the healthcare services? Patients, we individuals. Why we consume health and healthcare services? Because to achieve welfare, to increase our happiness or satisfaction level. If the population is healthy, our welfare value will be higher, right? So as I mentioned that economics is now a more integrated and complex field of study. Why? Because if we look at the WHO definition of health, is that health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So look, physical, mental, social well-being. Well-being means welfare. So that's why I have developed my definition after studying or understanding all these basic economics or previous economic definitions, that mental, physical and financial struggle to get welfare, well-being, right? So that's why economics has been applied in the field of health and other field of studies like environment, etc. Like today we studying climate change, etc. Right? So this is the diagram from the WHO website. Like this is a human, like physical body, mind, like mental. So this is our household or family circle. So our mental welfare or physical welfare depends upon, or our socio-economic welfare depends upon personal behavior, right? Physical personal behavior, right here, like the definition of Robbins or Marshall. So if we come down, so social environment, also physical environment, also like lesser air pollution or water pollution or land pollution, right? So this is our circle which affect our lifestyle, our work and self-care system, and then our culture or whole biosphere. So it means economics is related, already has been related to other field of studies. Now this diagram will elaborate the application of economics in a different means. Here at the base, at the core, we have population health, and what affect our population health are different determinants like this. Now if we say first, we will be discussing the economic determinants, like in economic infrastructure, like what I said, that better communication services, better hospitals, better education infrastructure, right? And then institutional determinant also affect. So there are layers, like these are contextual determinants, means somewhat related to. And as we go to the core of the health, so here we have health policy, health related policies, etc. These are our distal determinants. And the very nearest or proximal determinants are like health services. Health service means hospitals, doctors, nurses, or pharmaceutical resources which we have, and these will affect population health from institutional side. And we have discussed the economic side, and then socio-cultural side also affect our health, like our culture, population, or social infrastructure, how our societies have been laid out. So here comes the knowledge, social interactions, and social environment and lifestyle also affect the health of a population. And then physical environment. This was socio-cultural environment, and this is physical environmental determinants like ecological settings, our ecosystem, like forests, green areas, like ecosystem goods and services, right? And physical environment like food and water, rivers, canals, etc. Everything, forest.